Hello, everybody. I am Dr. Dave Donohue, and I am delighted to talk to you today about successful aging. You can reach out to me at david.donahue@poplar.care with any questions. Today, we're going to talk about vascular and heart health. This is an important topic because heart disease is our leading killer, and it is the leading killer in the United States and also worldwide. And the incidence of heart disease death has been increasing worldwide. Heart disease is one of the vascular diseases. Other important vascular diseases include stroke, which is another leading killer. And as we'll see, many diseases are vascular diseases. Let's go through an example. Let's say this lady starts to develop chest pains. So she starts to develop heart disease, which is so common. She'll get a treadmill test of the heart. Not everybody who has chest pain has heart disease. So the purpose of the stress test is to try to identify, does she have heart disease? So let's say that she ends up having a positive stress test and they find that there's reduced blood flow in one of the coronary blood vessels, the blood vessels that supply the heart with its blood supply. So what's going to happen to her? Well, most commonly in this country, in the United States, we see people getting channeled toward a stent. So if there's a blockage, a significant blockage found on the stress test, then she will end up often getting a stent. The problem with a stent is, although it makes sense that that would solve the problem, it really doesn't, because we've done these so-called sham controlled trials like Courage and Ischemia trial, where they've taken people and they've randomized them to either get the stent or to get a fake stent, a sham procedure in which the stent is not placed. And then they follow folks. Nobody knows who has the stent and who doesn't. And guess what? The people who got the stent did no better than the people who got the fake sham procedure. So we know from multiple such studies that stents do not save lives, they do not prevent heart attacks, they don't even prevent chest pain, and they come at a significant risk of harm. So oftentimes people might get channeled toward a coronary bypass surgery, which does have a very slight, we think, have a very slight benefit in terms of reducing your risk of dying from a heart attack. But it comes at a very considerable cost of a high rate of people having cognitive problems afterwards, possibly a very low level of brain damage, as well as kidney problems and even mortality, death around the time of the surgery. Versus you look at the intensive lifestyle counseling that's been done in some research, and we find that this can yield a 44% reduction in major adverse heart events like heart attack or stroke after the lifestyle counseling. And it comes at no risk of harm from the medical system. You might get an injury when you're exercising. Here's the paper from Dr. Dean Ornish and colleagues for that study, the lifestyle heart study. And what they found is that after just 24 days, the majority of people, like that young lady who was experiencing chest pain, the majority of people are not having angina. There's a 91% reduction in the frequency of angina in just 24 days. And what was the intervention there? They ate a low-fat vegetarian diet, they stopped smoking, they had stress management counseling, and they increased their exercise, moderate exercise. And what they found when they followed that population of people for 5 years is that that's when we see that 44% reduction in heart attacks and other coronary events. And what's more, we also see regression of their coronary artery disease, whereas the normal rate, the normal course for someone with coronary disease is we see that plaque getting worse and worse with time. The people who were given the treatment, the lifestyle counseling, experienced a regression, a slight regression of plaque over the ensuing 5 years. So heart disease is our leading killer in the United States and worldwide. And what is the leading modifiable risk factors that lead to heart disease? Well, number one is high blood pressure. The top number, the systolic blood pressure, is far and away the number one cause of our number one cause of death. And number two is dietary risks, high LDL, which is kind of a dietary thing. And then interestingly, we see number four is elevated particulate matter pollution. So that's a form of air pollution, PM 2.5, a very deadly and inflammatory pollution. Interesting that it's an even bigger contributor to heart disease than smoking is now. So, elevated blood pressure causes a whole host of problems. It's not just heart attacks, it can cause strokes, it can cause cognitive decline, heart failure, problems, sexual dysfunction, problems with pregnancy, and problems with peripheral artery circulation. So we've run this program called Heal My High Blood Pressure, and in the course of 6 weeks, we share a lot of science. So today I'll share the highlights from that program and some other science. So the name of the game is to try to protect these blood vessels. And what we see in the Western society is very frequently we start to develop plaque. We start to develop injury to our blood vessels. Our blood vessels are aging. They're getting less elastic. They're accumulating cholesterol plaque and inflammatory plaque. And this plaque can reduce the blood flow, cause our organs to not function as well, have less muscular strength, less perfusion to our heart, less exercise tolerance, less perfusion to our brain, and less ability to remember things and cognate. So it causes problems throughout the body. And so, as they say, vascular health is human health. And we shared some of the science on how can we lower blood pressure, and Dr. Michael Greger on nutritionfacts.org shares a list of things that have the potential of lowering blood pressure to a certain degree. And in particular, he finds that restricting alcohol, losing 10 pounds, eating more fruits and vegetables, all these things can lower blood pressure a little bit. Regular aerobic exercise, more when people went a little farther with the diet and ate more fruits and vegetables and less meat, they had a bigger reduction. When they went to a totally plant-based diet, they had an even bigger reduction. Lowering sodium is important. Taking blood pressure medicines are important. And the biggest factor was when people combined a plant-based diet with supervised medical fasting. That's when you saw massive reductions in blood pressure. So we do know from lots of research that more plant-based diets do reduce blood pressure. If you look at people who eat increasing amounts of meat, decreasing amounts of meat, increasing amounts of vegetables in their diet, we go from somebody with an omnivore diet to somebody who's semi-vegetarian. They've reduced their blood pressure by 23%. When we go to pesco-vegetarian, we've reduced our blood pressure by 38%. When we go lacto-ovo-vegetarian and we cut out the fish, we've reduced our blood pressure by our incidence of hypertension by 55%. And in this study, the Adventus 2 trial, the people who ate a vegan diet, and it tends to be a healthy vegan diet in this population, more plant-based, they had a 75% lower rate of having high blood pressure. So we know high blood pressure is not a fate that we just get because of our genetics. We have a lot of control, and diet plays a huge role. This is a picture of the food that we tend to eat in the West. It's salty, it's fatty, it's calorie dense, often fried. It's highly refined flours. It'll have sugar in it. It'll have processed meats and the preservatives that are in processed meats, the nitrates. This is a regular old lunch that we tend to eat in the West. And this regular old lunch has processed meat, has cured meats, has salt. The bread is the leading source of salt in the American diet. And everything inside this sandwich, except for the vegetables, is even saltier than the bread. So this is a huge load of salt, fat, no fiber. So what are we going for? We want to go for eating the rainbow. We want to eat more fruits and vegetables. When you're eating the rainbow, for one thing, you're eating these wonderful compounds called flavonoids, these micronutrients, which are anti-inflammatory, antioxidant, and we think they have the power of helping to prevent the progression and onset of high blood pressure and of heart disease, and even help our vessels heal. Nitric oxide is a chemical I want to introduce you to. It is an important compound. It is a hormone that our body creates to help our blood vessels heal. Nitric oxide has immediate direct effects on the blood vessel. It causes the blood vessel to dilate. It relaxes this smooth muscle layer around the blood vessel, but we think from a variety of other research that it helps reduce inflammation and prevent clotting. And so as we age, though, our ability to create nitric oxide decreases, our blood vessels become more stiff, and we have decreased blood flow to our organs. So there is copious research that says that when we are able to raise our nitric oxide, we lower our blood pressure, we get better blood flow, we can normalize sexual function, we can get better cognition, and a variety of other benefits. So how can you boost your nitric oxide production? Well, you can eat your greens. Greens are sources of plant-based nitrates. So eating your dark greens in particular, spinach, arugula, kale, collards, beets and celery. Beet juice is a source of nitrates, has been found to improve athletic performance. So another element of our diet is sodium. Sodium is so important for blood vessel health and heart health. The recommended amount of sodium is less than 1,500 milligrams a day. In the Paleolithic era, we think that people ate about half that. Our U.S. intake is more than double that recommended level. So we eat much too much sodium, and we don't eat enough potassium. Potassium has the opposite effect. It lowers blood pressure. In the Paleolithic era, eating lots of fruits and vegetables all day, every day, we ate 10,000 milligrams a day of potassium. Recommended is over 4,700, and we tend to eat only 2,500. All in all, if you take sodium and potassium together, less than 0.015% of Americans eat the recommended level of sodium and potassium. In our program, we do this quick exercise called the nitric oxide dump, which there is the theory might lower blood pressure. It's not completely proven, but it is a quick little exercise that gets the blood flowing to your important major muscle groups. So the squats, and then working those shoulder joints with alternate arm raises, jumping jacks or non-jumping jacks where you do the same thing but you don't jump, and then shoulder presses where you just raise your arms up, down, up, down. So this exercise has been found to be helpful in general, qualitatively, but quantitatively, if you want to look at the research, what exercises lower blood pressure, the number one way to lower blood pressure in the research was to do the wall sit. So this is where you just sit with your back against the wall and just count to try to get to 2 minutes if you can. And what do these folks experience? A significant amount of blood pressure reduction. So the way that one way to do the wall sit is to do multiple 2-minute exercises in the course of a day. So this is a 14-minute exercise in which you do 1, 2, 3, 4 different 2-minute wall sits in the course of 14 minutes with a 2-minute rest in between. Your legs will get a workout. Another form of isometric exercise, isometric means you kind of hold a position in place, is to get these hand grip devices. And what you do is you squeeze them and hold them. So four times 2-minute squeezes. So you hold that squeeze for 2 minutes. Do that for 8 weeks. It lowered blood pressure by 7 points systolic and 5 points diastolic. It has been found to possibly improve cognition and maybe even be associated with longer lifespan to be doing hand grip exercising. So certainly getting a brisk walk or jog is vitally important. We recommend 150 minutes a week of moderate intensity exercise that is to say, exercise to the point where you could talk but not sing. You're getting a little winded, you're breaking a little sweat. If you're not tracking your steps daily, and you can do it with your smartphone in your pocket, or you can get a fitness tracker like those pictured here. If you're not doing it, I recommend you do it because pedometer steps are an important indicator of your life expectancy and your vascular health. Yoga is thought to be very healthy for the blood vessels and for the blood pressure. Meta-analysis found that it lowered blood pressure about 11 points systolically. It combines the mindfulness with the movement. It takes a good 12, 13 weeks to get benefit for exercise, so keep that in mind. You're not going to see benefits immediately. Stress is obviously a huge contributor to heart disease and to vascular disease. Stress causes problems from head to toe. It certainly causes high blood pressure. It can impact the quality of our immune system. It can impact certainly our mental health, our emotional health. So one of the things we like to do is slow nasal breathing. This is a little mini exercise you can do anytime throughout the day is slow nasal breathing. You can do it as you sit at your desk at work. Take a 2-minute break and breathe slowly through your nose. It will reset your mind. You will be able to think more clearly. And this review found that breathing exercises can reduce systolic blood pressure from somewhere between 4 and 54 millimeters of mercury. So that's a huge range. The point is that there's a lot of different studies that have looked at this, and some find very slight effects and some find big effects, but there's a good chance that breathing exercises will help lower your blood pressure. A biofeedback tool that helps you breathe in a really healthy way is this thing called HeartMath. It basically trains you to do slow breathing with 6 seconds in and 6 seconds out. It gives you biofeedback to let you know, am I on the right track? Am I increasing my heart rate variability? And what they find is that people doing the HeartMath had a bigger reduction, a 10-point reduction in systolic blood pressure versus a 3.7 point reduction for the control group. So very significant benefits. If you say the nose, nasal breathing is an important thing, and if you're having trouble nasal breathing, you can use this substance called Xlear, Xlear. It's a pretty effective xylitol nasal spray that can clear out your nostrils. Because why would I talk about nasal breathing? Because we think when we nasal breathe, we actually are inhaling nitric oxide. So that's one of the ways our body produces nitric oxide is in the nasal passages when we breathe through the nose. And we think that it has multiple benefits, including increasing tissue oxygenation, improving mood, possibly memory, and it might have beneficial effects for preventing infections and improving quality of sleep. Now, if you wanted to add on, really boost the amount of nitric oxide that you're doing, you can actually hum while nasal breathing. And the research has found that actually boosts nitric oxide production by 15-fold. So there's a yoga breathing technique called Bharamari, which caused reduced levels of stress and lowered blood pressure. So humming while you're nasal breathing. And if you want to take it a step further, you can do alternate nostril breathing where you close one nostril and breathe in and out, and you close the other nostril and breathe in and out. And believe it or not, this has been found in multiple studies to yield much lower blood pressure. So for example, this study, just in day 5, they experienced an over 40-point drop in blood pressure. So that is a dramatic result. Results may vary for you. I'm not going to promise a 40-point reduction in blood pressure, but it might be worth trying for 10 minutes twice a day to do this alternate nostril breathing through your nose. So now another program we maybe should have is Heal My High Cholesterol, because high cholesterol is an important topic for sure for vascular health. And ultimately, the solution to high blood pressure is just eat more whole plants. It's almost that simple. We have time and again in our practice, we see people come to us with high cholesterol, like this young man who came to me with new onset type 2 diabetes and quite high cholesterol that he had developed because he was eating fast food. And he returned to eating his more traditional way of eating that he had grown up with from India. And his cholesterol came down by 70 points. I mean, the kind of reduction you see with cholesterol medication. So we can tell if somebody's made dietary changes by did their cholesterol come down, because it is very reliable. This will happen in just a couple weeks. And what's more, with his dietary change, he was able to reverse his type 2 diabetes as well and maintain these benefits, most of these benefits, for 5 years out. So when we eat the foods that we commonly eat, like fried chicken or broiled chicken or chicken wings or chicken, or the French fries that we're so fond of, or when we eat the American breakfast, we're eating a lot of saturated fat. We're eating a lot of salt. We're eating a lot of refined carbohydrates with the breads. And it doesn't have to be that way. You can eat the whole plant foods instead. So it's more salads, it's more tofu dishes or bean dishes or um, all sorts of other kinds of entrees that are just non-standard. They tend to be more moist. Your breakfast can be instead this wonderful fruit nut, berry, and grain bowl, multi-grain bowl, and with nuts and seeds in it, and flax seeds and wheat germ. Super healthy stuff, lots of fiber. It is going to prevent diabetes. It is going to prevent vascular disease. There's a few other measures of vascular health we don't hear about as much. Everybody's heard of blood pressure, but there's this thing called pulse pressure, which is the difference between your top and bottom number, and we want that to be as low as possible, because when it's lower, that means your blood vessels are more elastic, and as they get stiffer, you get a higher pulse pressure. Blood pressure variability is not a good thing if their blood pressure is going up and down throughout the day. We think that might be related to stress, so we want to reduce our stress level. Um, Heart rate is another indicator, so that's the pulse rate, how many beats per minute. The lower the better, and actually people who have lower heart rates live longer. So you can lower your heart rate through both aerobic conditioning and strength training and eating beans. Beans, it turns out, lower your heart rate. And heart rate variability this is one where you want it to be higher, because this is a measure of your so-called vagal tone, your parasympathetic nervous system activity, your rest and digest system. You want that to be active, because that allows us to heal our bodies and have less heart disease. So you want to, again, de-stress. Supplements, people always want to say, well, which supplement should I take? So supplements is a moving target. There's always new research coming out. There was a very large meta-analysis done recently where they looked at over 40 different supplements and asked the question, which ones lower blood pressure, which ones lower cholesterol, which ones make you live longer? And the most powerful one for lowering blood pressure was genistein, which is one of the soy isoflavones. So taking about 54 milligrams a day seems to lower systolic blood pressure by 10. Alpha lipoic acid is another one which was found to lower blood pressure. It's in small quantities in certain vegetables, but you tend to have to take a supplement. Results may vary with any of these supplements. Some people swear by their magnesium and say it helps them sleep better. It helps all sorts of things, but it can lower blood pressure, especially if you're deficient. So, and coenzyme Q10 was the one supplement that did extend life expectancy in those who have been randomized to coenzyme Q10 in clinical trials. So taking probably about 200 milligrams twice a day might be life extending and might lower your blood pressure. Folic acid is important for people who have elevated homocysteine or people who don't eat their vegetables. A lot of people in that category are folic acid deficient. They're deficient in folate. Aged garlic extract appears in several randomized controlled trials to promote healing of our blood vessels, 2 pills once or twice a day. So let's get to your assignment. What do I recommend that you do this month? Well, for one thing, you can get advanced vascular lab testing. So we didn't talk a lot about it, but there's a number of blood tests that aren't as commonly done, but that have a pretty strong predictive value of how much risk you face for your heart and whether you might be at risk for a heart attack. So one of them would be this LP little a. This is kind of a once in a lifetime measure of a sort of super cholesterol that some people have genetically. It's not very modifiable by our behavior or our diet, but if you have an elevated LP little a, it becomes all the more important to control your other risk factors, because it means that you're clogging your arteries at a faster rate than the average person. TMAO is a measure, a compound that was identified in the last 10 years or so that also can clog up the arteries. Inflammation in general is quite unhealthy for your blood vessels. It's unhealthy and it's known to contribute to cancer formation and also a host of other problems. So we can measure your inflammation with a high sensitivity C-reactive protein. It does correlate with life expectancy. There's a number of others like uric acid, insulin resistance, folic acid, measuring that homocysteine level, which can result when you don't have enough folic acid or not enough vitamin B12 or not enough vitamin B6, insufficient level of coenzyme Q10, insufficient nitric oxide production, omega-3 index, and whether you have an elevated aldosterone hormone. All these can have important implications in your blood vessel health. You can also measure your ApoB, which is a more accurate measure of your LDL level. So in addition, I encourage you to reduce your salt intake. We eat too much salt. One strategy is eat some meals that have no salt. So some meals are a little bit sweet and they're not the savory. When we eat savory, we're eating salt. So when you eat a multi-grain bowl, or when you're eating my beloved purple sweet potatoes as a lunch or as a breakfast or a dinner, you're not eating any salt at all. There's no salt in these meals. So that's one strategy. And of course, assignment number 3 is maximize your greens. So important. So here's a strategy for that. Try to do 3 different things every day. So I call it the green smoothie, big salad, and cooked greens challenge, where you try to have a green smoothie maybe for breakfast, try to have a big salad maybe for lunch or dinner, and try to have cooked greens. So 3 different kinds of greens. You can do steamed greens or throw them in the skillet, hopefully not with eggs, but maybe with a tofu scramble for breakfast. They can be in a wonderful Buddha bowl, but trying to eat your greens 3 times a day, because the nitric oxide boosting effects of your greens and your nitrate-rich vegetables, it lasts about 5 hours. So it doesn't last all day. You can't do it once a day and get all the benefits. Finally, maybe think about doing some movement exercises that are going to be healthy for your blood vessels, like yoga or the isometric strengthening exercises or other strengthening or any kind of movement in general. And then finally, the alternative assignment number 4 would be the maxed out total mindfulness smackdown, where you're going to be stacking multiple breathing behaviors all in the same go and see if you get meaningful benefits for your blood pressure that way. So nasal breathing slow nasal breathing combined with humming, combined with alternating nostrils, 5 to 10 minutes twice a day. And let's see if that can really lower your blood pressure. And with that, we have concluded our program this month. I wish you a heart healthy and a vascular healthy month. I hope you learned some new skills, developed some new really healthy habits. I wish you every success. Thanks for joining in, everybody. Good luck.